welcome to Studio DOHC, an informational podcast focusing on your health from experts at Desert Oasis Healthcare. I'm your host, Christine Ticman, and today we have an exciting episode in store for you. Today's topic surrounds a question that we feel everyone needs an answer to. When is it appropriate to go to the immediate care, and when should you go to the emergency room? Depending on the answer will reflect on the type of care you need, the type of care you should receive, and how long it would take for you to receive that care. We'll share both benefits and how Desert Oasis Healthcare Immediate Care can help in most cases. And of course, I couldn't do this alone. I'm thrilled to have the brilliant Dr. Heather Jones with us today, our expert in the field. So welcome, Dr. Jones.
Thank you, Christine. I'm really happy to be here today with you.
Thank you, Dr. Jones. We're very glad that you're here with us. Thank you so much for joining us. So if you could briefly give us a little bit of background about yourself, the type of practice you've had the experience with, your current position here at the immediate care, with Desert Oasis Healthcare, and how long you've been with us.
Oh, okay, great. Well, my name's Dr. Heather Jones. I moved here about 3 years ago. I'm actually a board-certified family medicine physician. I was working in Montana for 20 years doing just overall rural medicine. We did inpatient medicine, outpatient medicine, emergency medicine, skilled nursing facility, and nursing home. So we kind of did it all in the rural area, and moved here about 3 years ago to get out of the cold.
Yeah, wow. And I can imagine servicing a rural type of community, you've had the opportunity to really see a lot of different types of disease processes and medical conditions, I would imagine.
Yeah, the training was good. The experience was great. And I felt really good to kind of bring those skills to Southern California.
Well, I know firsthand that we're very happy. I feel very fortunate and lucky that I get the opportunity to work with you at Desert Oasis Immediate Care. So today, we just briefly wanted to talk about, a hot topic. Lots of people are always wondering, why do I go to the immediate care when I can go to the emergency room, or vice versa, right? So we really wanted to kind of sit down with the public today and discuss some of the reasons why we think you should come to the immediate care. And then obviously some of the life-threatening conditions that really would warrant an emergency room visit. So if Dr. Jones can kind of enlighten us on what we think really warrants an emergency room visit, just based on her expertise, we think she would be great to let us know why we should go to the emergency room.
Well, there are some things, most of the things that present to the immediate care are things that we can take care of and we can deal with in the immediate care and get you safely discharged home. There are several things that I would say that if it happens, you should probably go to the emergency room. A couple of those things, there's not many, but there's a couple. One would be, say you're outside, you're on a ladder, you're at a really high height, you fall off the ladder and you hit your head and pass out. Well, that would be something I would say, you could have a fracture, you could have a severe head injury. And I would say with something like that, you should probably call 911 and go to the emergency room.
Right.
Other things that may warrant an emergency room visit, a stroke. It's very, very time sensitive. If you or your loved one develops sudden onset of slurred speech, difficulty finding your words, weakness in your arms or legs, inability to walk straight or move your arm or leg, I would say, that's really suspicious for a stroke. And in that case, time matters. You need to get to the emergency room quickly. I wouldn't go by private vehicle. I would call 911. I would get there and get to the emergency room as soon as possible. I guess the other thing I would say, chest pain. There's chest pain and then there's real chest pain. And I would say, if you have severe crushing chest pain, you may have a history of some cardiac issues. You may have diabetes, high cholesterol, high blood pressure, some risk factors. You may smoke. I would say in that case, if you have severe crushing chest pain, it's not going away. You take an aspirin, it's still not going away. I think in that case, I would say that's probably something that you need to go to the emergency room for. Other things, I would say, if you just don't know and you're not sure if you're having a heart attack, you're not sure if you're having a stroke, you can certainly come in. We don't leave people that have possible life-threatening illnesses sitting in waiting rooms. We have a very highly qualified staff.
Yes, we do.
That will identify that you are in need of immediate emergency care. We'll get you back. We'll get you taken care of, seen by the physician, and we'll make a decision whether you truly do need to go to the emergency room. We can always call 911 and get you there as quickly as possible as well. So,
Right. So, in other words, we would really like to emphasize that if you're currently experiencing what we would call life-threatening symptoms, then those would definitely warrant an emergency room visit. But in most cases, Desert Oasis Immediate Care is absolutely here. We're a well-trained, qualified team of healthcare professionals, and we know how to intervene quickly. And like Dr. Jones said, if you needed emergency room care, we would do everything we could to make sure that we would stabilize you from our clinics and get you to the care that you need, which will take us into our next question. What types of visits do you feel really kind of warrant immediate care visits and coming to us in our immediate care instead of going to the emergency room? What types of cases would you see in our clinic?
This is my favorite question because I would say like almost anything that you can think of. We are now care, we're immediate care. We get the job done quickly. We get you back quickly. And really things that I think of really would be an immediate care type visit is, you wake up and your blood pressure is really high and you take your medicine and you can't get it down. What should I do? Come to the immediate care. We'll take care of you. We'll see if we need to adjust your blood pressure medicine. You've fallen and you are concerned you may have a fracture. We have radiology capability. We can x-ray you. We can splint you. We can take care of that. Say you went hiking in the summer and you shouldn't have, and you're dehydrated.
In this heat right now.
And you're dehydrated and you didn't take enough water with you. Well, come on down because we can do IV fluids. We can take care of infections. You may have a pneumonia that doesn't require hospitalization. You may have a skin infection, anything like that. We can give IV antibiotics.
Right.
We can even do things, people don't realize this. We do have a higher acuity immediate care here at Desert Oasis. So, people that have possibly a cardiac arrhythmia, somebody that may have atrial fibrillation, which is a cardiac arrhythmia, their heart might be going too fast. We can give cardiac drugs through an IV to help with that and hopefully keep you from being admitted to the hospital. At least we can look at you and say, hey, is this something we can deal with here? See if we can get you turned around and then decide, is this something we need to send you to the hospital for? Other things, lacerations, lots of people cut themselves, especially with the tourists coming around and hiking and all the outdoor activities that we can do here in Palm Springs. We can do laceration repairs. We can do incision and drainage of abscess. And then just, your general medical concerns that somebody would have. We all survived COVID, and we were really able to take care of those patients that really, didn't want to sit for hours in an emergency room. If you've got a cold, if you've got the flu, if you've got a respiratory illness or a
sinus infection, migraines, headaches.
Yeah.
I think the list goes on and on.
Yeah.
I mean, we can really genuinely serve a variety of healthcare conditions. And with trained professionals like Dr. Jones and our wonderful team, we have what we call, or what I like to call, a one-stop shop. So almost like your super Walmart, right? You can, at a super Walmart, you can get your McDonald's while you're having getting your groceries, and then you go to the beauty section and pick up your toiletries, and at the same time, you're getting an oil change. And so I'd like to say that our immediate care, different from most, is that we have really the capability of doing such things. Like Dr. Jones was saying, not only are we able to see you for minor conditions, but also some major conditions, chest pain, palpitations not associated with severe shortness of breath or life-threatening conditions. But even things like that, where our patients get the benefit of being put on a cardiac monitor where most urgent care settings don't have, I think is something that is special that we provide as a service. We can do same-day labs with results back within 15, 20 minutes of the time of the draw. Same day radiology for x-rays. We have the capability of doing CAT scans and ultrasound stat, which again, these are all tools and services that we provide same day that I like to think makes us a one-stop shop. So definitely conveniently located. We have 4 clinics throughout the Coachella Valley, one in the high desert, Palm Springs, and Indio. We're open Monday through Friday from 8 a.m. to 8 p.m., 7 days a week. On the weekends, we're open 9 a.m. to 7 p.m., pretty much open all holidays. So just like an emergency room, access to us is very easy. And we really like to say, come in and see us. We're happy to evaluate you. We have a team of compassionate, confident, competent staff who really genuinely care for our patients. We have lower copay cost, right? Shorter wait times. I mean,
I think, one of the things that I always look at, especially coming here from Montana, I'm just really impressed with, we are staffed with 2 to 3 physicians with a advanced level practitioner, such as a physician assistant or nurse practitioner. There's direct coordination of care between us and the advanced level practitioners with the patients. Our doctors are board certified in internal medicine, family practice, emergency medicine, which I really think gives us an edge in that we've had a lot of experience in emergency medicine and in urgent care. So when you come to us, you're getting somebody that knows what to do with your situation.
Exactly.
I think it's a diverse group of doctors we have, and I think we all have our strengths, and we kind of work with those strengths and get you to the best provider that can take care of your medical situation.
Yeah, I agree with you. And the same for, our clinical staff and all of our registered nurses and licensed vocational nurses who are on staff. They're all BLS and ACLS certified. So they really know how to act quickly during times of emergency. And we have a team that really works together and we collaborate. It's almost like playing a beautiful musical melody, right? We all have a role and we do it all very well together. So definitely happy to work with you and the team that we have. I can say from firsthand experience that the immediate care has really helped out a lot of my own family members. So it's a great place to come to, and we really try to make our patients feel welcome, and we try to really connect with them. And that's really one of the reasons why we try to emphasize that Desert Oasis Healthcare is such a good organization. And that we have resources and tools, not just from the immediate care standpoint, but just as an organization as a whole. One of the things that I'm very passionate about, Dr. Jones, is care coordination. I love to kind of endorse that healthcare in general really does require care coordination. I'm so passionate about it, especially with my case management background. And I think that's something that the immediate care does very well. We're not just a treat and street type of clinic. We really like to connect our members. We want to meet our patients at their level and really try to provide them with the best care that they need. And we also want to make sure that there's continuity in care. So some of the things that the immediate care can do if you are a Desert Oasis Healthcare member are even things like getting you to a skilled nursing facility if you have a skilled need. We do coordination of care where we can get you plugged into programs such as referrals to home health, palliative care, hospice, social service referrals. I mean, our team is well-versed and trained to be able to evaluate for programs and resources that Desert Oasis has to offer. And so, again, we're really kind of bringing what that patient needs and meeting them at their level, trying to ensure the best that we can to connect them and really kind of drive the mission that we are patient-centered. And so the fact that our immediate care can do that while treating your urinary tract infection, we're making sure that you have resources at home, things of that sort. It makes me feel very proud to work for an organization and in a department where we're providing this type of care to our patients. And it's one of the many reasons why having Desert Oasis Healthcare is such a benefit to our community of patients that have our organization. Because you get that type of access to care, which is so special, right?
Yeah, and I would like to kind of go off of that a little bit as well. One of the things that I've found quite impressive is, our pharmacy program, our medication management program. What I've seen so much in the past, because I was a family physician for 20 years prior to this, there's so patients have difficulty knowing what they should take, how much they should take. They have difficulty with access to medication. They have difficulty with cost of medication. And some people don't even realize how expensive, glucometer strips can be for patients. And one of the things that I try to identify when I'm in the immediate care is not just taking care of their immediate need, but also asking them things like, do you have enough medicine? Can you afford the medicine? Are you testing your blood sugars? Do you have enough glucometer strips? And I think that that's where, our medication management program really comes into play, and that they're there for them. They can kind of coordinate their medications and make sure that they're getting what they need, and make sure the patient's actually taking the medication.
Yeah, I completely agree. What do you think about the wait times and how we differentiate between the emergency room and us at the immediate care?
Well, I would say, even as a person that had to utilize the emergency room over a year ago, the wait times for your run-of-the-mill cough, sore throat, cold, so anything that's not an absolute emergency, you can wait 5 to 15 hours before you get seen.
Wow.
I would say, and even when I was in the emergency room, I thought to myself, maybe I should just drive back to Palm Springs and go to the immediate care.
Yeah.
While I'm sitting in the waiting room. And mainly because I feel, when patients come into our waiting room, it can be 15 minutes. It may be 2 hours. That would be an extremely long wait. But the wait time is definitely shorter. And also, you always have this cost thing. We see all insurances. We see PPOs. We see Desert Oasis patients. We see Medicare patients. And I think it's a really good option for people to say, okay, maybe this is something that I don't want to sit in the emergency room with a bunch of other people in a big waiting room with hundreds of people.
Exposed
and wait
to who knows what.
Exactly.
Right?
And wait, 5 to 10 hours to be seen. Come over to Desert Oasis. We'll get you back quickly, and we'll get you taken care of and get you home.
I agree. Yes. So we do see a variety of insurance health plans, Medicare, like you said, cash pay. And I don't know if a lot of people know, but Desert Oasis Immediate Care, we also run a triage. The way in which we see our patients is very much like an emergency room. So obviously, if there is a patient presenting with what we would consider an acute or severe situation that requires immediate intervention from our staff, then we assess those patients immediately upon check-in to make sure that you're getting the right type of care immediately. So just like an emergency room, we don't want anybody unstable sitting in a lobby, but definitely shorter wait times than the emergency. I couldn't imagine waiting 15 hours for a cough. So things of that sort, we're happy to see you here in our immediate care.
Yeah. And the cost. You have to remember the cost.
That's true. Lower copay, right?
Lower copay, lower overall cost, quicker care.
Yeah.
And we just take care of you and get you home.
Tell me from your personal opinion why you think we're able to handle the high volume of patients that we see on a regular basis, and what makes our workflow comparable to an emergency room?
Well, I think Desert Oasis strives to make sure that everything is running well in every aspect of the organization. All the way from the administrators to the management, to make sure that we have protocols, that we have well-trained staff that know exactly what to do in every situation with the patient. When I see a patient, I don't see what happens out front, but, the patient comes in, the patient's greeted by the front desk, they're checked in, their insurances are verified, they make sure that they contact the nurse, that there's somebody in the waiting room. We have nursing staff that goes out and evaluates the patient. We have unit coordinators that are able to see what the patient's needs are, coordinate between the programs, make phone calls, make transfers for patients, get transportation if needed, and just really a lot of behind-the-scenes organization that makes it run smoothly.
Well, we hope you learned some valuable insight into today's topics and apply it when you need it the next time you need care. Remember that Desert Oasis Healthcare is here for you and can handle a lot of what you need in our immediate care locations. We have several locations spread throughout the Coachella Valley. To stay up to date with our podcast, please subscribe, hit that bell, and give us a like. For more on us and what we do, visit mydohc.com. Until next time, remember,
Your health, your life, our passion. Bye-bye.